Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Broken neck. No really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately he passed away about 2 weeks later due to the cancer. Patient was lactating, but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Wow, I didn't think anyone would even read this, or I would have explained better or tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also please, if you are concerned about your health in any way, or are not happy with your doctor/care, obtain your medical records, and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off, and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said it was nothing, and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, tridge and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so ducking patronizing with our concerns and shove his face deeply into his own ass. My friend's sister had a very similar experience. 10 years of asking about it, and no doctor took her seriously until she was pregnant. She died 2 years later, edited a typo. Going to take this opportunity to say you are never too young to have cancer. Everyone waved her off saying you're too young, it's just a mole. If you think something is off, pester your doctor until you get the attention and tests you need and deserve. I suppose I have one for this as a resident doctor. We saw a kid in the eMERG for difficulty walking. He had been slowly losing the ability to walk over months, and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me, and I'm not even good at this yet. Did a CT scan. Big ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. Edit. Thanks everyone. The history was that he really declined further over the last few days prompting the ed visit, so he looked really bad for us, but I'm not sure what he looked like before. To any med students reading this. 1. Do an exam. 2. It's okay to cry sometimes. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. I run into this a lot as a surgeon. Very few primary care providers will do a rectal exam. Just tell the patient that rectal bleeding probably hemorrhoids and give them ointment. If it doesn't resolve within a few months, I get the referral for hemorrhoid surgery and find the rectal mass. Either that, or find a colon cancer on the colonoscopy that they should have ordered months ago. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point, when the pain became too much to bear, she went to the ER and got a cord. Turns out she had stage 4 colon cancer with 4-inch tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she'd probably still be alive. Edit. Wow. Thank you everyone for the kind words and awards. It's disturbing, but sadly not surprising, to see there are so many similar stories to this. If you feel like something is off with your body, trust your instincts and don't listen to doctors who try to tell you otherwise. For the record, this was not in the US. I don't want to say where I'm from to protect my friend's privacy. Small country, and she has a sibling who used to be on Reddit. Any doctor could have sent my friend to a colonoscopy, but I guess it was easier to write her off. The cancer may have killed her, but the reason for her death was apathy. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays, told her she had a sprain, and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. Holy shit. Losing a foot is a serious consequence to something so normal. I don't understand why they wouldn't do an x-ray. Of all these stories, this one is the strangest to me. Why would you give someone a moon boot and not x-ray? Are all these stories sheer incompetence, or are hospitals in America for profit / won't do things deliberately to save money? Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before, and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him, I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass, suggestive of lymphoma. Sadly, I don't know what happened to him. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. Once when I was a medical student on surgery rotation in trauma, we had a patient come in after he fell on the street and bumped his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we scanned his abdomen and saw his common bile duct was like 3 times normal size, could drive a truck through it. About that time, next set of vitals, his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. I like how you use the word bunked. I hope it was the same language in his medical record. What's your diagnosis, doctor? Doctor takes his glasses off, pinches the bridge of his nose. The patient has hella head barnkage. There was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift and started feeling lightheaded, dizzy and fatigued. Given how intense those shifts are, 26 plus hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right. Not a doctor. We had someone at work die at her desk, and it took almost 12 hours for someone to realize it. They thought she was sleeping and only realized something was wrong when they tried to wake her up at shift change. Anytime I see someone sleeping in a strange area in public, I immediately wonder if they're dead. One that comes to mind is when I was a resident. The ED doctor wanted to admit a mild septic patient with a UT. I review her labs, and knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive fourth fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. OMG bless you. As a parent of a type 1, the hospital terrifies me. I've seen studies that say there are worse outcomes due to lack of knowledge of care. I will call the endo every hour when he's sick and spoon feed crushed ice every 3 minutes for hours to keep us home. DKA kills kids. And definitely kills young adults once they leave the care of their parents. Bless your catch, and please tell this story over and over. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So how long have you had manuscript?" That was the first she was diagnosed. She had been battling various manuscript symptoms for a couple of decades without a diagnosis. It's amazing how many diseases can be detected during an eye exam. Diabetes, cancer, multiple sclerosis, thyroid disease, lupus, rheumatoid arthritis, Lyme disease, brain tumors. Speaking as a patient. When I was a kid, my eyes were hurting, and my dad kept taking me back to the same eye doctor, who insisted that the problem was that I wasn't cleaning my contacts properly and just kept giving me harsher and harsher chemicals to wash them in. It got to the point where I couldn't open my eyes fully in a room with the lights on, and I hadn't worn contacts for months. Finally, after a year, my mom forced my dad to take me to a different doctor. Literally, he met me in the waiting room, looked at me with his naked eye, and said, "You have a raging eye infection." A month of antibiotics and the infection was gone, but there was so much scarring and damage it was 20 years before I could wear contacts again. Edit, getting this question a lot. I was a kid at the time. I didn't know the difference between an optometrist and an ophthalmologist, and it was over 2 decades ago. I do not remember if I ever knew. Sorry, I can't tell you. A lot of people are saying that optometrists are basically just for routine checkups and getting glasses or contacts, and if something is actually wrong and you need a diagnosis, go to an ophthalmologist. Update, I'm now getting pushback on this too. Apparently the distinction between optometrist and ophthalmologist is less drastic than some of the earlier people implied. Again, the only thing I personally recommend is that you do your own research and come to your own conclusions. I don't personally know if that's true or not, but feel free to do some research. It's a thing several people have said now. I've only gotten the one troll so far showing up to tell me he is 100% sure I'm lying, because that's clearly what people do for fake internet points, and he will not have it, which seems low for a Reddit post. So I'll take that as my good fortune of the day. In residency I saw a cardiologist miss a STEMI heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died, and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though. It was obvious on ECG. It was like textbook tombstones on the ECG, no idea how it was missed. Not a doctor, but actually the patient. I had a doctor prescribe me birth control. While in line to pay for it, I'm reading the paperwork that comes with it, and learn that another medication I'm on, permanently and every day, completely voids out any effect the BC would have. I went back to the pharmacist and asked about interactions, and he says I may have side effects. I ask which ones, and he says pregnancy. Pregnancy is not a side effect. It is a lifelong commitment. Then I call the doctor and ask why they would prescribe something they knew wouldn't work, and she said, butyl asked for BC. Like, yeah I did, but I wanted some that would work. Silly me for not specifying that. Well, that's bloody horrifying. I'm so glad you figured that out before you ended up pregnant, and it's probably a fair guess that the other medication you're on is likely not a great one to be on when pregnant, so a double whammy. Patient getting anxious about numbness in his hand. It's getting more frequent, and I don't want to live like this. It gets me freaked out like my hand's not there. They assumed the person was suicidal and having symptoms of panic attack, elevated breathing rate, tingling/numbness in hands. They did a court because I requested it. There was a lesion. They blew it off. MRI showed it was glioblastoma multiforme. Edit, clarifying, it was missed by the physician assistant. The MD supervising them never spoke to me. Not even sure if they reviewed the case. What is that? Glioblastoma multiforme? Glioblastoma, also known as glioblastoma multiforme, GBM, is the most aggressive type of cancer that begins within the brain. 6. Initially, signs and symptoms of glioblastoma are non-specific. 1. They may include headaches, personality changes, nausea, and symptoms similar to those of a stroke. 1. Symptoms often worsen rapidly and may progress to unconsciousness. 2. We found it early actually. I'm in a different field so didn't follow up thereafter. Neurologist sent patient to our ED without informing her that imaging showed a glioblastoma, assuring her impending death. He didn't overlook the disease, he overlooked the communication. He just sent her over for you to do the dirty work of telling her she was dying? Geesh. That is the shittiest thing one doctor can do to the next. I'm not a doctor, I'm a nurse, but not in med-surg. My sister had her gallbladder out, routine surgery, and 2 days later woke up at 4 AM in searing pain, went to the ER by ambulance. I met her there. The ER docs were all apparently convinced she was a drug seeker and did not even conduct a physical exam beyond taking her vitals. They snowed her to shut her up because she was just yelling help me. Help me. I'm dying. They did eventually do an MRI but said it was negative and sent her home. She didn't want to leave, insisted something was terribly wrong, but they said they would call security and have her thrown out. At this point I'd like to mention that she had no history of drug or alcohol abuse. She continued to get worse at home, and the next day went to a different hospital. They did a workup and found that the metal clip that closed off the bile duct had cut right through the tissue, and she had a large bile leak that was literally burning all her abdominal organs. She had to have 3 surgeries to fix it and was hospitalized for 9 days. Left with chronic pain from adhesions and chemical burns. When the new hospital finally acquired the MRI from the original ER visit, she was told that the leak was small but clearly visible in that image. Life pro tip. When seeking a second opinion, don't tell them it's a second opinion. You want a second first opinion, not a confirmation of the first opinion. I have been to multiple doctors who would not contradict the diagnosis of another doctor, even with test results that ruled out the initial diagnosis or confirmed a contrary diagnosis. I was thinking about this reading all the other responses. The reason you get a second opinion is to get a fresh pair of eyes. If you bias them by telling them, then their eyes aren't fresh anymore. I dodged an amputation by going at it as a second first opinion. On the other end, I had a whole team of doctors refuse to tell me I was having seizures because my insurance hadn't approved that billing code. So they essentially ignored and did not document symptoms like Todd's paresis. When I went to a doctor outside their system, it was immediately identified and treated as an emergency. Ooh, I've got a good one, albeit sad. I was working nights and a patient came in for a nail bed repair under general anesthesia. It was a slow night. As they're anesthetizing him, he aspirates, so we do a chest x-ray to see if he's got any spit/blood in his lungs. What we didn't know is that prior to this emergency surgery, he'd been going to his GP for over 6 months complaining about chest tightness. They'd put him on various different asthma medications, but none had any effect on him. The x-ray showed a massive dark mass in his left lung. We kept him asleep and transferred him to ICU. His wife and 3-year-old daughter were waiting for him on the ward. We had to tell them where he'd gone, why he'd gone there, and what was going to happen. He died from lung cancer within a month. Edit, a general anesthetic is absolutely ridiculous for a nail bed repair, but he refused to have it done under local. A commenter below rightfully corrected me, and after talking with a colleague, the dark space in his lungs was the normal lung, and the rest was whited out because they were riddled with tumors. This man was in his late 20s, a non-smoker, and I couldn't move past the situation for months after it. Not a doctor but the patient. When I was born, I was my dad's 3rd child, 2 from a previous marriage. He knew something was wrong with me because of the way I was breathing, very rapid, short breaths. When I was 3 months old, they noticed there really wasn't a change. The first hospital he and my mom took me to, they said that there was nothing to worry about, and babies just breathe like that. He was 100% certain they were wrong. They took me to a second hospital, and they said there's definitely something wrong. But they didn't have the technology to help. 1986. They recommended us to a 3rd hospital, which was a couple hours away. Finally, the 3rd hospital took me right in and performed surgery that day. Turns out I had 5 holes in my heart. They tried to go through my ribcage, but it didn't work. They had to crack my sternum and go directly through my chest. They took my heart out of its body and patched the holes. I'm doing wonderfully medically today, and I'm forever in their debt, not financially, thank you Ronald McDonald House. Not a doctor, but I've been dealing with abdominal pain since a child, countless ultrasounds, doctor appointments, visits. I was always told it was in my head. Recently had surgery for something and related during the surgery the had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck all they could do was free it, and they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out. Let me guess. Are you female? People love to dismiss it when girls and women have abdominal pain. Edit, since this got a lot of play and countless women have already shared their stories of being ignored while experiencing life-threatening health issues. It is never normal or okay to have extreme abdominal or pelvic pain. Don't accept dismissal from doctors and insist on being thoroughly examined. Men, please help advocate for your partners, mothers, sisters, and daughters. This is a serious problem. I'm the patient in the story. When I was a toddler and started walking, my extended family noticed that I would waddle a lot. My parents didn't really notice it because they grew used to my funny walking, but my grandma and my aunts that saw me so much less often insisted that I had a limp. So my mother asked our pediatrician about it, and he reassured that it was nothing and would fix itself when growing. 1 year passed, and it didn't fix itself. It got more noticeable. My mother asked again to my doctor. She asked for an x-ray to make sure everything was fine, and the doctor bite her head off for wanting to expose me to the rays. He insisted it was nothing but referred us to a specialist anyway. The specialist suggested my parents put some wool around my leg that had the limp, because wool would warm it up and speed up the growing process. Right. My dad finally had enough. It was summer and my regular pediatrician was on holiday. His partner visited me because meanwhile the limping became really bad and my parents wanted another opinion. The new doc measured my legs. There was a 4 or 5 centimeters difference between the two legs. They sent me to a specialistic children's hospital to get it fixed right away. I had severe dysplasia. So severe my right hip didn't have a socket for the femur bone. 3 years and 3 surgeries later, months of physiotherapy to learn to walk again, I was normal. If the second doc didn't catch it, I would have grown up disabled. He split up with his work partner, the first doctor. Second doc is now my daughter's pediatrician. Yet another, not a doctor, but my grandmother had a lump on her tongue, and when she went to the doctors the person who examined her said it looked benign, but didn't feel comfortable, so said she should go to an expert, lest it become malignant. A more senior doctor decided against that, and blocked the proposition. A couple months later it is malignant, and she needs half her tongue cut out plus tonsils.